The advances in the science of psychiatry are so phenomenal. No, we're again moving backwards. I did a video a couple days ago, yesterday, day before, about how electric shock therapy is making a comeback. It's never gone completely away. It's just not widely used. But now the experts of psychiatry, they feel that that should be used more. And another thing they're bringing back, it's talk about going back to the 50s and 60s. They're just living there. They're bringing psychedelic therapy back. Not that it was called psychedelic therapy back then, but they did a bunch of things with psychedelics back in the 50s and 60s until they had to put a stop to it. But that's where we're going. Not moving forward, we're going back. And the thing they never focus on, and this is what frustrates me, is I think a lot of these problems we need to stop trying to address with drugs and just be there for patients. Help them get through these moments. I don't think that's ever been tried because it doesn't serve Lucifer. I'm sorry, Big Pharma. So, ketamine therapy. Let me give a little background about ketamine. Ketamine it's special K. Ketamine is the special K drug known. I think it's known on the street as special K. Date rape drug. No big deal. No big deal considering the 92 pages of abuses that have happened. And this is not all psychiatrists or social workers. It's not everybody in the field. But you know, a lot of places they don't get the best characters. It's a wide range of people, but it's not the whole profession. So. But just it's something to take into consideration. So ketamine is an anesthetic agent used to anesthetize children, and it's used very rarely in extremely specific conditions in adults. It causes dissociation from surroundings, and it's a good pain relief without having any depressive effects on respiration. There is no way a person can know once he or she is drugged by ketamine. If the dose is sufficient, the person will go off to sleep and will wake up hours or days later once the effect of the drug wears off. So they use this. I've never, but I know they do use it in ER. If they have a psychotic patient come in that's violent, they will give that to them because it'll put them to sleep quickly, but it doesn't last very long. I guess that's probably based on this. They give them a very small dose of it. So it's only a few minutes. I think it's success. I mean, I don't think it's successful to calm them down for the moment. Ketamine, this drug causes hallucinations in adults, and the person can suffer bad dreams for years. No big deal. It's ketamine therapy for psych. The drug also can cause a condition where the eyes keep shifting from one side to the other. This is a trait characteristic because of the increase in blood pressure the drug causes. Once drugged, it does not feel like an alcoholic high. It is much like being anesthetized, where you will not feel any sensation, neither pain nor any other discomfort. A person who is drugged is also likely to be unable to move on his own. Ketamine is known as a dissociative anesthetic, where you will likely feel dissociated from your surroundings and yourself. After the drug has worn off, you might feel depressed, have loss of memory, lack of cognition or understanding, and be extremely anxious. So that's okay. That's okay because we're going to use it. I wanted to mention ECT is what many people don't know. And it's not a barbaric therapy. I don't think it's something that should be used, but that's my opinion. But it does cause brain damage. I mean, that should be an obvious one. It's electric current going into the brain. So many times it can cause some cognitive problems. Maybe nothing that's very obvious, but it does cause brain damage. So when we're using a treatment where we're causing brain damage to the person, even if it's a small, it's likely that we don't have the best people operating in the area of psychiatry science. Okay, Now, on to the way that the experts want to use it. Oh, a little bit more about ketamine. Ketamine, also known as Special K, is a dissociative drug that makes people feel out of control or detached from reality. Nothing wrong with that. You should use it for psych patients. The hallucinogen causes tolerance and cravings, but reports of ketamine dependence and addiction are rare. Now, how they've used this or have been testing it with teletherapy with ketamine. The treatment doesn't simply consist of taking the drug on your own at home. In the study, patients first had a session with a guide to build the correct set, which means the patient had to have the correct mindset and attitude. Okay, well, if they did, then why would they need to do the... Okay. You know what I mean? Because they already are having trouble with having the right mindset. Okay. And it's also to help set the surroundings, the environment for the psychedelic experience. That's what it says. That's what the experts say. The treatment is indeed named ketamine-assisted therapy, or CAT. Here, the guide is not a licensed psychotherapist. Of course not. There's no reason you need that. Just get anybody that's out on parole, give them a job. They can do this. But instead, a trained individual that listens to the patient and helps them to integrate their experience, as well as monitoring symptoms and side effects during and after the psychedelic experience. Science, wow, they're experts. Ketamine-assisted therapy allows your therapist, I guess this is if you have a therapist and not just a trained assistant, allows your therapist to make positive suggestions to your subconscious, ultimately changing how your brain processes thoughts. Over time, you will notice you have more positive thoughts than negative ones. Most people participate for 2 to 6 sessions to receive the greatest benefits. Okay? And then they've also been doing MDMA-assisted psychotherapy. Everybody knows that one. That's the date rape drug, too. This psychedelic treatment is the closest one to receiving FDA approval. I'm sure it's the FDA. They'd approve anything, wouldn't they? So they're under phase 3 of their clinical trials. They basically said they saw improvement with this too. So, yep, they've gone back. We're not moving forward in psychiatry. We're moving back. So now we're using drugs. I would imagine eventually we'll be using heroin, IV heroin or PCP. That they'll find some reason these can be helpful. Really, why don't they just bring back oxycodone at this point? I mean, I know those aren't psychedelics, but still. Okay. So it causes dissociation. So I talked in a video on my other channel about dissociation. This happens when there's a severe trauma. It can happen to an adult. It's most often seen in kids. I've seen it happen to kids. Their eyes glaze over. So like they're there, but they're not there. They're somewhere else. It's a way the brain protects itself. It's one of those gifts the way God made our bodies. So that when there's a severe trauma happening to that person, they disconnect. They're not there. I mean, it's not a good thing to happen necessarily, but it's a way of the body protecting itself. So they dissociate. But this will create dissociation. Ketamine will create that. So I understand it to a certain extent, not really. I mean, I'm sure they look at it like the person with severe PTSD, because again, this will be used for your resistant patients, the ones that aren't responding to any of the medications, which will be many. So take, for instance, somebody who has severe PTSD. Yes, it would seem like a good idea. It gets them to dissociate. But see, here's my problem with all of these ways that science goes about it with mental health, is that eventually that person is going to have to face that. Science's idea is get rid of it, bury it. Try psychotherapy, but they have made patients so dependent on the pills. And I don't mean literally physically dependent, but they've made them dependent on not having to work at anything and more just give me a pill and fix it all. And I'm not saying there's not some people that even when they try to but I think there has to be a faith-based approach, which science, no. No, if it's a Satan approach, then yeah, but that's pharma. So they would be totally against the whole, no God, no Jesus, I just say that because, I was a train wreck. And everybody would probably say, well, you didn't have PTSD. Yeah, I did. I had a lot of problems. It was from drinking, but I had a lot of problems. And I didn't go on any drugs. I had to do some work. I had to look at some stuff. And I'm not saying that that's the answer for everybody. I just think that eventually you're never going to get better until you really do that. And really what we could do as a mental health profession is be there for patients. But see, that doesn't serve Lucifer. They just want all the drugs. But I have found some of the best ways that you can help patients is just by being there, just by sitting with them, even if they're psychotic. Like, even if they're psychotic and they can't understand me, I just will put my hand on theirs. And humans understand the heart. What comes from the heart reaches the heart. And sometimes that's what's needed until they get over these, till they start talking. And it depends on the situation. But that's many times what people want. And that's why the healthcare system is so poor, because there isn't that for patients, because they leave us so short-staffed. But I think that would be the better approach to go. But again, it doesn't serve the powers that be, and they want the medicine to be the answer for everybody. That's why they've made so many people dependent on the medicine. So I was going to play just a portion of this expert that was talking about this, how great this new ketamine therapy is. So here's this expert.
About 2010, I was medical director of the Psychiatry consult service at a large hospital out here in Utah. I had a background in clinical trials. I've been watching pretty closely the literature coming out about ketamine as a rapid antidepressant. And I happened to be in the perfect setting to be able to try ketamine for mental health indications, because I was surrounded by medical colleagues who gave ketamine all the time for things like sedation, and they were quite comfortable with it. I remember the first time I gave it to a client, in fact, I asked with a bit of hesitation to one of my medicine colleagues, what do you think about this crazy idea of giving a low dose of ketamine to a mutual client who came in after an overdose? And their reply was something like, yeah, sure, why not? Let's do it right now. And so we did. And we saw some striking results in terms of rapid reduction of symptoms of depression, suicidality. And my interest just grew from there. I got a grant to study it from Intermountain Healthcare back in 2010, and then did a clinical trial for Janssen using IV ketamine for treatment-resistant depression, which they were conducting as part of their strategy along their path to Spravato approval, which we'll talk about. So over the years, I continued working with ketamine in a variety of settings, and as the evidence continued to pile up in support of ketamine for depression and other indications, then a few years ago, I saw that clinics were starting to pop up offering ketamine infusions for depression, many without any mental health support or any mental health clinicians on board. So I was really interested in exploring the best ways of offering ketamine and pairing it with psychotherapy. And so one day I was just struck by this calling. I felt the need to start an outpatient clinic and help figure out how to offer ketamine-assisted psychotherapy in a safe, effective way and in an accessible way within the mental health system, leveraging insurance wherever possible to expand access. So I co-founded a clinic called Cedar Psychiatry, offering all the traditional things like diagnostic evaluations, med management, psychotherapy, and ketamine therapy as an additional option, especially for our clients who didn't respond to traditional treatment options.
Okay, so that's enough. That's enough of experts. So, and obviously I'm not going to judge him. I mean, maybe he has seen some results. I mean, I guess it's better than continuing to, just add all these meds onto people. But I don't think it's the answer. There's a reason they stopped doing it back in the 50s and the 60s. I didn't look to see what that reason was. They said something about the hippie generation. I don't know how that would have stopped it. But, we were told for so long these are dangerous drugs because of the hallucinogenic effects. I just think that, again, this is something you don't know what the long-term effects are going to be. And maybe there won't be. I'm just saying that it would be nicer if we moved forward instead of backwards. Maybe they're not getting any more grants and funding for psychiatry. I don't know. Or maybe they're just pocketing our money and they don't really want to do anything like forward moving. But I think that truly, my opinion, and I'm no expert, just my opinion, that if we made more time to make time for the patient, and I don't mean so much in a setting where it's a therapist and the patient. I sometimes don't think there's a whole lot to gain from that. Not that there's not. It's just that when somebody's in crisis, that's when they most need somebody to sit with them. And yet they come into the hospital and then we don't have the staff to do that. Some one-on-one time just to, it doesn't mean you're going to cure them, but a lot of times I think that makes a big difference. Just some human intervention. But again, because Lucifer controls the science and Lucifer is big pharma, it's always going to be about the drugs and never about caring.